This is NextGenWeb.org, continuing its coverage from the Center for Connected Health Symposium at Harvard Medical School. We're joined this morning by Joe Ternullo, who is the Associate Director for the Center for Connected Health and also a Vice President at Continua Health Alliance. And Joe, we appreciate your time this morning.
Thank you very much. Glad to be here.
So Joe, what's the overarching goals here of the symposium you're having?
So this symposium is unique in a lot of ways. The primary goal is to be a convener, to bring people together, to share knowledge with experts, and to facilitate networking opportunities to help move the field forward. We're really fortunate to this year have, I don't have the final count, but somewhere in the neighborhood of 800 people who have come really from around the world. And I'm told that this particular symposium brings historically the largest percentage of clinicians to a healthcare IT conference. So we have a broad cross-section of payers, providers, vendors, policymakers, academics of both the international and domestic variety.
Now, Joe, the program here at Mass General in Boston, the Center for Connected Health, has become a leader, certainly, in the telemedicine field. How do you all communicate your successes here so that we can see other programs like the Center for Connected Health pop up all over the country?
So, first of all, thank you very much for your fine comment about our program. We're proud of our program. Ours is one of many programs that are also very, very successful. We feel that our program is successful. It's attributable to the, I guess, a couple of factors. One, the vision of the leadership of Partners Healthcare to invest in the development of an urban telemedicine program. Most telemedicine programs focused on solving challenges relating to rural, underserved communities that need access to quality care. Now, it's the vision of Joe Kvidar, who's the director of our program, a physician, vice chair of dermatology at Harvard Medical School, that one can be in a downtown urban setting, but because of some sort of illness, be as underserved and remote from care as someone in a rural setting. So imagine if you are wheelchair bound, you're on the third floor walk up of a building downtown, you can't make it to the subway system and so forth to get to your doctor. You don't have family caregivers to help provide you with care. That individual is just as underserved as someone in a rural community. So my thought is that it is a tribute to the leadership of Partners Healthcare to invest in a program and help develop it as they did ours. And I want to hasten to add there are many, many successful programs around the country that we could learn a lot from. Many of them are here today.
Right. And finally, to that end, healthcare over broadband, healthcare over high-speed internet. You mentioned some really good examples before. Are we seeing, increased, improved quality of care for patients?
So here's my answer to that particular question. We look to other industries as a model. So I'll say the banking industry is a model that comes readily to mind. The way banking is conducted today. ATMs, you can be anywhere in the world and you can access your bank account. I think that we're seeing the same transformation of an industry in healthcare, and broadband is an absolute essential part of it. The interesting thing about this particular symposium is not focused on technology as an obstacle, because it isn't an obstacle. It's not focusing on broadband as an obstacle, because it isn't an obstacle. What it's focusing on is success stories and economic impediments that are yet to be resolved. That's the primary impediment for the healthcare system that we might envision in a truly connected health world. And that would provide incredible opportunities for improved care, for building people's careers as there are new job opportunities for people, for policy making, for academic presentation, for grant opportunities, and to help bring the world closer together through the diffusion of health care.
Well, Joe, congratulations on a great event, and we really appreciate your time.
I can't thank you enough for taking the time to talk to me and for being here. We really appreciate it. If there's anything we can do to help you along the way, we'd be more than happy to.
That's great.
Okay, thank you.
Great. This is NextGenWeb.org continuing its coverage from the Connected Health Symposium at the Harvard Medical Center.